Good afternoon, everyone. I'm John Carney. Good afternoon, everyone. Delaware. I'm John Carney, the governor of the state of Delaware, and I'm joined again today by the director of Division of Public Health, Dr. Carol Rattay, and also our point person on the response to the COVID-19 pandemic, the director of the Delaware Emergency Management Agency, A.J. Shaw. I want to thank both of them and their teams for the tremendous work, and take this opportunity again to thank all the healthcare workers, all the workers at hospitals across our state for being on the front lines and treating patients who are COVID-19 positive, who are coming into their facilities with concerns that they might be COVID-19 positive and are getting tested and admitted to the hospital when they need hospital services. We appreciate the great work that they're doing. In addition, the work of our first responders, ambulance drivers, EMTs, paramedics, all those law enforcement officers, our correctional officers, every state and local employee on the front lines, and our hospital workers are doing a tremendous job, and we appreciate the sacrifices they are making to keep each of us safe. We're going to walk through a series of slides as we have the last few conferences. We have a few more today. I'm going to set the table with the situation on the ground, the numbers that we have out of yesterday. You can see on the board we have an additional number of cases, up to 1761 positive cases, since the first case confirmed back on March 11th, 2020, so we're over a month into this. Sadly, we've had a number, 6 new deaths over the weekend, and that totals up to 41. And of course, our thoughts and prayers are with the families and friends of those individuals who've passed. We've actually had 277 recoveries, and as of yesterday, 204 hospitalizations. You'll recall that that's the number we really focus on for A.J. Shaw's work in standing up alternative care facilities that we'll talk about a little bit later. So the number of cases are divided among our geographic areas, 919 positive cases in Newcastle County, 288 cases in Kent County, and 551 positive cases in Sussex County. We have actually had 3 cases with unknown geographic origin. So here's the breakdown by age. We pay really close attention to this, and one of the observations that we'll make later is that the median age of those who have tested positive has been going down. That's a really good thing, and because the real risk for hospitalization and the need for critical care services in our hospitals is for our senior citizens and those with compromised health conditions. The largest group, of course, remains to be that group from age 18 to 49, and still very small numbers for children and teenagers. So here's the projection graph that we've been working with. We started with a graph that we received from FEMA, and have been working with our actual numbers over the last several weeks. And the good news is we're seeing the number of hospitalizations, which the number we track really carefully, has been consistently under our conservative high estimate of 20%. So if you look at the maroon numbers and the gray number on top of that going forward from the 14th, which is today, forward, that number on top, the hospitalization number, is 20% of the number on the bottom. And that's really where you're going to see that surge that we were protecting against from the beginning, and that all our social distancing and stay-at-home orders were designed to impact. The actual number for today is 11.6%, so considerably under that. And so we'll be thinking about in the future adjusting that assumption to something less than 20%. 20% came out of a kind of the worst case scenario. I think it was the percentage that was being used in New York several weeks ago, and so we felt like having a conservative estimate on the high side would be the best way to proceed, but it's likely the number has been tracking less than that. We're still up in terms of the number of total cases, 1,761 as of yesterday, up over 1,625 from the day before. I would also observe that, again, if you think about the overall objective, which is to protect that that hospital capacity, so when we get, if we get a surge, and when we get a surge, we have enough rooms, enough ICU, critical care units, and enough ventilators. Anyway, if you assume that 20% growth rate of hospitalizations to positive cases, that number as of April the 20th of 731 still is below our surge capacity statewide. And so that's a very good thing. If you factor in a lower assumption for the growth or for the split there, that number is going to be smaller still. So we're happy that that's tracking in a way that's manageable as we get down the road and with more cases. So we're hoping that the reason for this these numbers is all the actions that we've taken since the beginning of March, as we started and declared the state of emergency on March the 12th, and then all the closures of restaurants and bars and beaches and parks and schools, and then the quarantine for out-of-state travelers. We're thinking that that's having an impact. If you, in terms of flattening the curve, if you also think about the objective, which is really to protect the most vulnerable population, to protect those hospital resources, really doubling down on nursing homes and facilities, where we've had some issues, frankly, is really, really, really important. And I know Dr. Rattay and her team is really doing that, and Mary Peterson is getting out and visiting the facilities themselves, and we hope to have another amendment to our executive order today, providing some guidance for those nursing homes. Looking forward, you probably heard yesterday that Delaware, we decided to join a regional council, including the states of New York, New Jersey, Connecticut, Pennsylvania, Rhode Island, and Massachusetts. And that council will consist of one health expert, that will be Dr. Walker, the Secretary of Health and Social Services Department here in Delaware, one economic development expert, which will be Kurt Foreman, the Executive Director of our Delaware Prosperity Partnership, and of course Sheila Grant, my Chief of Staff. My main interest in joining this regional council was really twofold. One, I thought it was a real opportunity to get access to the best thinking on measures you need to take as you start to turn the lights on in your economy going forward. What are the conditions? What do the conditions have to be on the ground in terms of the health of the community before you can start doing that? What are those measures? What are the testing mechanisms that you need to have in place, and the testing capacity to do that? Because our testing is going to change from what we do now, which is more of a diagnostic testing to see if people are coronavirus positive, to one where we're testing, isolating individuals who are positive, and then making our contact tracking as the personnel at public health do now, so that you're able to allow more people to do more activities publicly and go back to work. We're not close to that now, but we want to start thinking about that as other states in our region are thinking about it. And then the second reason for doing that is some of the actions that we've taken in shutting down the economy here in Delaware has been based on the decisions of the governors around us, of Governor Wolf in Pennsylvania, Governor Murphy in New Jersey, and Governor Hogan in Maryland, because what they do affects us. We're a very small state. We're connected to these states by Interstate 95 and by the Amtrak Northeast Corridor. People come to Delaware to go to the beaches. They come to Delaware to shop. They come to Delaware to work in the thousands, and so we need to be acting and making decisions in concert with what's happening around us. That doesn't mean we might eliminate a certain restriction at the same time as another state, but we certainly need to know the thinking going into their decisions and its potential impact on the state of Delaware. So we're looking forward to that. Just to give you some idea of the effect of the stay-at-home order and the emergency declaration on daily traffic counts. This will give you an idea of that. The top blue line, if it's blue on your chart, is the traffic counts at I-95 just north of State Route 1, there by the mall. And 2019 is the top line, and you can see the drop-off there this year. Moving over to SR1, just south of the Dover Toll Plaza, and again, the graph of traffic there back in 2019, and you can see this year's traffic count. And then on 113 at Route 9 there in Georgetown, a similar reduction in traffic. Overall, the traffic across our state is down 70%, and we believe that that's having a very positive impact on the health and welfare of Delawareans. We hope that it's in some ways explains some of the reduction in the number of cases that we're seeing, or the growth of the number of cases is at a lower level. And some of the other things that we're doing with respect to seniors are paying off, and that median age of the COVID-19 positive individuals is now mid-40s, I want to say, AJ, and for weeks it was in the mid-50s, and so that's a good positive development. So with that, setting the table, I'll turn it over to Dr. Rattay for her remarks as well.
Great, thank you, Governor. First, I wanted to touch on how to safely go out in public. As Governor Carney just mentioned, it's been weeks now since the stay-at-home order, but many people do need to go out and get essentials, especially going to the supermarket and going to pharmacies. And for most people, fortunately now, this is one of the only places where they are getting exposed to COVID-19. But our reality is COVID-19 is widespread in the community, and as we have said many times, it's really important that we all act as though we have it and that everyone else has it. So we thought it would be important to just talk a little bit about going out and what's the best way to protect yourself. First of all, only go out for essential needs and really limit your visits to the store. I know some people are well organized and might go to the store every couple of weeks. Other people like to go daily. You really want to be limited. You want to get an organized list. Good thing to do is kind of organize it as you're going to be walking through the store. A lot of stores now have arrows on the floor and are doing one-way directions, which is a really good choice to go to a store that does this. That really helps support social distancing. We talked last week about recommendations to use cloth face coverings, especially places like grocery stores and pharmacies where it can be difficult to social distance. We recommend using a cloth face covering. Must cover your nose, must cover your mouth for it to be helpful. And so when you arrive at the store, first hand sanitize, get your hands clean, then put your mask on over your ears and your face. And make sure you take your hand sanitizer as well as disinfecting wipes with you. So when you pick up the grocery cart or basket, you want to clean the parts that you're going to be touching. You want to wipe down handles on refrigerated cases, as an example. Use hand sanitizer after you're touching things like, for example, the card reader for paying, or after you touch money. Don't shop with your hands, but shop with your eyes. This is a change for a lot of people. In fact, a lot of people will, touch fruit to see if it's ripe, That's not okay these days. So please only touch things that you're going to put in your cart and purchase. But it is important, as always, that you wash fruits and vegetables with water when you get home. And then if you're using any reusable bags, make sure you wash or disinfect them when you get home. This might not be a bad time to use those throwaway bags. So again, when you leave the store, make sure you hand sanitize again. You might want to hand sanitize about 4 or 5 times when you're out at the store. And again, we emphasize this because we really want people to be thinking about the fact that this is a widespread infection right now. Facilities, as Governor Carney mentioned, we continue to be extremely concerned about the patients and the staff at our long-term care and licensed facilities. I first want to give a huge shout out to the staff in these facilities. You know, we often talk about the heroes of healthcare workers who are on the front line. Well, this is a challenging time for sure to be working in a long-term care facility for many reasons. And we want to make sure that those folks in these facilities who are working know how much we appreciate the work that they do and how hard they've worked to learn to adapt to the situation that we are in. As we know, we have seen now 130 staff and residents at Delaware long-term care facilities who are confirmed to have COVID-19. And because of these concerns, in the latest modification to the state of emergency, you will see some updates related to long-term care, residential, home, and personal health care agencies, as well as those facilities that assist people with intellectual disabilities. So some of these updates will include things like home health agencies and personal assistance agencies will now be required to follow the same guidance that long-term care facilities must follow. For example, around PPE and screening individuals. This time when you go into a home, you should ask those in the home if they are ill. We feel it's really important that all staff in all facilities are being trained on appropriate screening, being trained on identification of COVID-19. What do the symptoms look like? What is it you should be looking for? How do you go about getting expedited testing, which is so important? How do you designate isolation rooms for when you are concerned that someone has COVID-19 or when you're managing someone with COVID-19? And also, very importantly, personal protective equipment. So all nursing staff, facility, and home health staff must complete this training that was sent out to them on the 10th of April. It must be completed by April 20th. And we're also doing some additional mandatory training for medical directors of these facilities. Let me talk a little bit about personal protective equipment in these facilities. As we have talked about before, we are in a conservation approach, or we are using PPE conservatively. This is guided by the science. We are following Centers for Disease Control and Prevention guidance around this, but as we know, it can feel a little uncomfortable to staff to use PPE in a conservative way, which often will entail reusing PPE, like masks. So the guidance that we give and the training that we are going to continue to provide to these facilities is around how best to use PPE preventively, but also while conserving it at the same time. Our guidance also includes how best to manage people with COVID-19, and also ensuring that individuals can return to their facility or their home if they have gone to the hospital with COVID-19. They may not be returning immediately if they are considered contagious, and so we're looking at alternative approaches. If a long-term care facility doesn't feel comfortable having a positive COVID patient, but we want to make sure that these individuals are able to return to their home or their facility once, according to CDC guidance, their infection is considered extremely low risk. Lastly, I'd like to touch base on our testing numbers. So in our state lab total now, we've tested 2,016 individuals. Among those, 365 are positive. We've talked about our hospital testing system throughout the state, and as of yesterday, 13,414 individuals have had tests through our hospital test system. With that, I'm going to hand it back to the governor.
Thank you very much, Dr. Rattay, and thank you in particular for your team leaning into the outreach and the requirements on nursing homes. We know that will have a positive impact on the numbers, obviously, the health and welfare of those individuals, both the residents of nursing homes as well as the workers in those homes. And we do give a big shout out to all those workers and the work that they are doing on a day-to-day basis. AJ?
Thank you, sir. Just to touch a little bit more on the projections, the governor opened up with it, but we had another meeting yesterday with the hospital executives from around the state. I will say we are in decent shape right now at the hospitals. As the governor talked about, the 20% number, we've been below that, so we hope it stays that way. We are monitoring their hospitalizations, the ICUs, the vents, a lot of their analytics to make sure we have enough time to react if needed. But as we look here, we're looking to the 20th. At the 20% mark, we'll still be in good shape at the 20th, and we're going to readjust that with additional data as we go on. Again, we can't commend enough the community partnerships that we have across the state. Food Bank of Delaware, an agency that I know a lot of us are familiar with, a lot of organizations volunteer with them, and hopefully they're still getting those volunteers that they need today to help with some of their missions. But over the last 3 weeks have distributed over 1 million pounds of food. They're going to be a very influential partner with us going forward. We know there's going to be individuals that are having issues putting food on their table, and we want to make sure we get them aligned with the right programs. And Food Bank is going to be planning potentially a drive-through pantry in each county in the upcoming several weeks, so we're going to support them any way we can with that. We also highlighted the Delaware Community Foundation last week, United Way, Philanthropy Delaware, again, agencies that are helping the nonprofits really expand their mission in this time of need. United Way, again, last week we announced that they utilized their 211 system to be their first line of defense for individuals from the state calling in with questions, whether it's labor-related, social services, or health-related questions, among just a few. And their team there have done a great job of really helping us not only kind of segment those calls to get to the right area, but gives us a little anticipation. We know that as the longer this goes, the more creative we're going to have to be to find ways to deliver food to vulnerable populations, help them get the prescriptions, other necessities that they need. So it's great ground truth to make sure we're planning and looking farther ahead. And then again, just to highlight the Sheriff Center in Georgetown, they're becoming creative. Meals on Wheels has been used to assist social services in providing meals to seniors. We know that number's gone up, and here we have a community center that's definitely helping us out with that. So again, we know we're going to have to anticipate what the community is going to need. This is not going to be something that when we do gradually relax some of the restrictions, as the governor said, there's still going to be that social need that's there. So we're going to work with Dr. Rattay's team and Dr. Walker's team over at Health and Social Services in really identifying those right programs and expanding them as much as we can and be creative with our partners. So, Governor, that's it for today.
And thank you, AJ. Just to underscore a couple things that you said. One is a great thank you to all the volunteer efforts that are happening out there. Food Bank and Food Distribution doing an incredible job. A thanks to the teachers and school districts who have come up with really, I think, creative remote learning opportunities for the students and children, and we really want them to get the most out of the last couple weeks here before summer, the last month or so before summer. And just to go back to the limiting factors that we talk about all the time, AJ mentioned facilities and ICU units and ventilators and whatnot. In our hospital call earlier this week, it sounded like the hospitals were in pretty good shape for testing equipment with, at the current burn rate, about 2 weeks of supplies, which is a healthy amount. some with more than that. Some of the hospitals had a little bit of issue with one piece of the testing equipment or the other. And then on the PPE, that we focus on that a lot. The big issue this week on PPE was gowns and a shortage of gowns out there. So we work on all those things to make sure that our hospital workers have what they need to be able to do the difficult jobs they have. One last thing I would say is that our executive order on daycare seems to be working out. There are enough daycares that are willing to stay open under the emergency order that we have to accommodate the workers, the essential workers at our hospitals and other businesses in our state. So far that looks pretty good. So we open it up to questions again to the media. Sorry for the little bit of a delay at the beginning, but thanks for coming to help us communicate with the people of our state.
Governor, we keep hearing the R word a lot more, reopen. Restaurant industry, they're saying, hey, we think we might be able to come up with some creative spacing in our restaurants, things like that. How dependent is it going to be on testing and the ability to sort of proactively test people and possibly even contact trace them through their phones and things like that, some of the ideas on the table?
Yeah, so absolutely. There's going to be a tremendous pressure there, particularly with all the discussion happening around us. I watched Governor Cuomo's press conference a little while ago, and he was showing graphs that showed peaking and getting on the other side of that curve, and obviously setting up the regional coalition was to start thinking about those, but we can't get ahead of ourselves. Our message today is stay the course. It seems to be working. We showed the traffic counts, and so that'll get us to a place where we can figure out what it has to look like. We want to have a healthy community and a healthy economy. You have to have them both. The question is, or the challenge is, you have to have a healthy community before you have a healthy economy. And so, as Governor Murphy referred to it the other day, as it's not going to be like turning a switch back on. It's more like a dimmer switch, where gradually the light comes on. And so it'll be a rolling recovery. What that's going to look like, we're going to work with the coalition to do that. I know that the Delaware State Chamber of Commerce has a group looking at that as well. We will look at the public health part of that, which is just what you talked about. It's going to be more test, isolate, and track. A little bit different than the diagnostic piece of that, and Dr. Rattay might want to comment on that. But it requires a lot more testing capacity. And so when the interaction we had on the White House call earlier this week was, we need testing capacity. There's been a lot of discussion over the last 24 hours about recovery and going back. Well, we need the testing capacity in order to do that.
Just a follow-up question, too, just about the president. He said he has more power than the governors. He talked about it as sort of a mutiny of governors. Do you consider yourself part of a mutiny of governors, or is this just the way it should be, that you guys as governors and women in Rhode Island should be able to do this on your own and make some decisions on your own?
Look, this is no time to pick a fight with anybody, right? This is a time for governors to come together and kind of sort out the best way to bring our economies back online and do it in a way that's safe for the people that we work for and who are relying on us to make those good decisions. So being part of a coalition, we're going to learn from other states. We're going to coordinate and cooperate with other states, and we're going to use the federal government to support us. We need that in the White House. But I have a better idea. Governor Wolf has a better idea. Governor Murphy has what's happening on the ground in our states than the White House does. In fact, all the data that they make decisions on is based on what we give them. So we shut the lights off, if you will, and we're going to turn them back on, and we're going to do it deliberately. We're going to be guided by the science, and recognizing that this is uncharted territory for all of us. And we're going to work together with our federal partners in doing that.
Thank you.
Hi. In these long-term facilities, specifically state institutions, I'm curious what factor staffing shortages have played in not being able to contain the spread of the virus.
So I'll turn it over to Dr. Rattay in a minute, but staffing shortages is a concern, particularly in facilities where we've had an outbreak, and I don't know that it's been an issue with the small outbreak that we've had on the correctional side, And Commissioner DeMatteis has done a really good job, and her correctional officers have really been on board in terms of getting tested as they come in for their shifts and being careful with their interaction with the inmates. Because our census is so below our capacity in the prisons right now, we have a capacity around 6,500 or thereabouts, maybe a little less than that, and we're down below 4,500. We have room. This inmates still, it's hard to do social distancing in certain times during the day, but there's a lot of effort going into that and protecting those. One of the biggest challenges, I think, in our other facilities is the Delaware Psychiatric Center, just because of the nature of the patients there and the interaction that they have with nurses and the workers and the psychiatrists that work with those patients. So it is, we have isolated a unit out there of the COVID positive patients, and so far there's been some questions about staffing, but so far we've been able to fill those shifts as far as I know.
Yeah, it's a great question. This is a challenging virus for a number of reasons, and as we've learned, there's more asymptomatic spread than with most viruses. So in some of the situations, we have seen the virus come into a facility from an asymptomatic staff member, and before we know, people have been exposed, and that's a challenge to prevent, right? But one of the changes that we're making now is any staff member, regardless of whether or not they provide direct care or not, will be wearing some kind of face covering. So before, those who were not providing direct care did not have a face covering, but now even custodial workers or others will be required to wear at least a cloth face covering. So we have certainly more recognition and respect for asymptomatic spread, but then the other pieces of this training really, and the protocols that are being really emphasized, none of it's super new, but it's also not always the way these places operate. So screening every single staff every single day for any symptoms that may be COVID related, which is we've expanded our list of symptoms. That's really important. And then everyone wearing appropriate PPE at all times in the facilities is incredibly important. Also, very importantly, when residents or staff begin to develop any symptoms, that testing must be expedited. It must take place as soon as possible, so that people can be isolated if need be, and appropriate precautions can take place. So a lot of good work is going on in all of our long-term care facilities and residential settings across the state, but we need to step it up because this is a really challenging virus to deal with.
And just going off of the training, has there been any issues with how these long-term care facilities are reporting data to the state in terms of accuracy, or people thinking that it wasn't related to the coronavirus, a death actually being related to the coronavirus?
Yeah, so as it relates to cases and hospitalizations and deaths, those data come into public health through testing data in general. So then we track, the individual's status after that point in time. I think you may be referring to last week, the Centers for Disease Control changed its definition. When you have a cluster of cases in any setting, you get to a point where it's not really necessary helpful to test everyone who has the same symptoms, because you know what you're dealing with. And so there were some deaths that were clearly COVID-19 that weren't tested. And so now, as of last week, there was a category by the CDC for probable cases. And so that's why you saw a change in how we reported that. Mm-hmm.
And in regards to ventilators, is there still an effort to get more, or just with hospitalizations being lower than what was expected, Is there any thought that these ventilators might be donated to other states that need them? I know California did that. Is there any thought on what the future ventilators will be here?
So we're certainly not looking for more. I'll let AJ respond to it. We've had some interaction, obviously, with California, and with respect to that need, I have touched base both with Governor Hogan in Maryland and Governor Murphy in New Jersey, just to keep track of their need vis-a-vis. California's had an interesting kind of arrangement. They sent and were willing to send some to us and other Mid-Atlantic states. We didn't request them, but we had to return them by April 21st. And it makes some sense. They don't need them now. Their curve is coming down in the future. They'll need them back. They don't want them to sit on a shelf while somebody else could use them in a life-saving purpose. So, but it also wasn't. You can look at our math. We're not going to need them by the 21st.
No, I think the governor covered it correctly. We are right now looking at what we could do to reallocate them and where the other hotspots are. So at the same time, we're going to monitor our hospital caseload and make sure, if something happens, we find a way to procure other ones or request them. But the ones that we'll request I will tell you, we are right now looking to see, we're working with California to redirect the ones we got them from them last week, and then we'll talk to public health about a few other options for other ventilators.
To be clear, they're not ours, right? So we can't redirect them on our own without consultation. But we thought, let's consult with Maryland and New Jersey, who seem to have the need. And then as we talk to California, say, you might want to look at our friends across our borders.
Thank you.
The next question's from the Delaware Public Media. They ask, where does the state stand on supplies of PPE that are still needed?
Hey, go ahead, AJ. I kind of touched on that, but what we...
So I think as everybody notices on the news, the supply chain is stressed. We have several orders that have been ordered, and we've received confirmation from them. It's just when are they going to get delivered? We've gone together on some big orders with other hospitals in the area just to get the attraction of some distributors. And then we've also put in another request with the national stockpile. So we are by no means out of the woods and not concerned about PPE. We know that we have to continue to make sure we keep track of it, know what we have. We've distributed a large amount of PPE to the first responders, to the hospitals, as well as nursing homes as needed. As Dr. Rattay said, we have to make sure they're under a conservation type strategy to make sure they use it smartly. And we know as these case numbers go up, there's a high probability that the PPE burn rate is going to increase as well, especially as individuals get put in the ICU or on ventilators. And so, it is something that our team at DEMA, Public Health, and Government Support Services looks at every day to make sure we're looking far enough out while still hoping that some of these orders we've placed get here as soon as possible.
So we don't count the order until it actually shows up, and part of that is because the White House Task Force and Admiral Polachuk specifically, who's been tasked to do that, kind of interrupts the supply chain, if you will, to redirect some of this PPE and other equipment to states that need it more than maybe Delaware does. And so it's like our testing, it's a week to 2 week, supply, and then, we work them down and try to make sure that we have a replenishment for the next increment.
Another question from the Delaware Public Media. How many hospitalizations will exceed our hospital capacity and might force the state to use the alternate care facilities that have been established?
So it's kind of a moving target. I'm going to defer to AJ, but it depends on the census, i.e. the number of patients in the hospital for other reasons, right? They have pretty much emptied their buildings out. There are no surgeries, elective surgeries that they would otherwise be doing, filling up rooms and that kind of thing, and that's a big number. So we have quite a bit of capacity now, but it does move from day to day, and we keep track of it.
The only other thing I would add is we also know that an influx of critical patients may need more doctors and nurses than those that are less critical. So having a number is what's difficult. I will tell you, we are constantly on the phone, whether it's us or public health with the hospitals, to get the metrics and made sure that we have enough lead time for anything. The hospitals have also, their partnerships are as strong as could be, where they are going to, transfer patients to make sure they're inside a hospital, brick and mortar hospital that we have in the state before we put them in the gym at Nemours or some other type of alternate care facility. So I'm not sure if Dr. Tay wants to add anything additional.
Nope, that was great.
And just the strategy is, if we get to that point, we move the non-COVID-19 people into these alternative care sites so that the hospitals can treat the COVID-19 positive.
Matt Biddle at the Delaware State News asks, what does the president's declaration of a major federal disaster here mean for the state in terms of financial assistance? Is the state still awaiting guidance from the feds on this?
So I think we know back in March, the president signed the disaster declaration for all 50 states. Then we requested the major declaration just about 2 weeks ago. And I think right now, between those programs, between the stimulus, the CARES Act, the stimulus package that went out, there's going to be a lot of federal support that comes to the state of Delaware. I think it's too early for us to know what programs are going to align with what stimulus package or the disaster declaration. We do know that we have a 75% reimbursement for a lot of the protective measures and staffing, PPE purchases that we're doing, that could come in. But we also, that there's a lot of other guidance that's still going to come out on the CARES Act that I think we're still trying to peel back the onion on. I'm not sure if the governor wants to talk about that because it's too soon. On the major disaster declaration, there were additional individual assistance requests that we had, and that's still kind of what's under review at the federal level. And as we go through this, I think we're going to get more guidance, whether it's something the state's going to support with reimbursement or if it's going to be a FEMA program that we get supported by.
Yeah, I would just say that it's, we're still waiting for specific guidance from Treasury on the largest stimulus package. These emergency declarations, they're a little bit more specificity or experience with it. This is a different kind of an emergency than we've had in terms of tornadoes and hurricanes and that type of thing. So there's still a lot of questions that need to be answered. A lot of people working on that, staff at the congressional delegation, Senator Carper, Senator Coons, Congresswoman Blunt Rochester, and their staffs. Treasury in our White House calls each week. Secretary Mnuchin is normally on the call and gets questions about just these issues. How can the money be used? For most states and localities, it's can we use the money for lost revenue? I mean, we could lose $500 million in revenue because of with the economy shut down. I mean, that's $500 million on a $4.6 billion budget. That's a lot of money, and states and local governments across the country are experiencing that same loss.
Mallory Metzner at WRDE says, people are saying they're having issues accessing unemployment benefits. What's being done about this, and is anything being done for people who are self-employed?
Yeah, so we don't have our expert here today on unemployment, Secretary Cade. I will say that he and his people are doing a Herculean task, a job with a very difficult task. We had, in 2 days, broke the monthly record for unemployment claims back a few weeks ago with over 11,000, and we just didn't have the staff to process the claims. So they've not been processed as quickly as we all would have liked, but they're using some creative measures to do that and trying to help the people that are really in great need. There's also the need to explain both to business owners. We were on the conference call yesterday with Restaurant Association, and they have a majority of their workers, or a large number of their workers, that are on unemployment, and lots of questions that they have for their employers that Secretary Cade was able to answer yesterday. I don't have all those answers with me. I don't know that AJ does or Dr. Rattay, but it is an issue that we're trying to stay on top of. A very difficult one, I must say, just because of the volume of claims that have come in. There is an extra a benefit, up to $600 benefit for coming from the federal government, which will really help those individuals and I think importantly circulate money back into the economy.
Tom Lehman at WBOC asks, Governor Hogan was not part of the coalition announced yesterday. How is Delaware coordinating with Maryland, which borders so closely, on the reopening of the state's economy?
Yeah, I try to keep in touch with Governor Hogan. He's wearing two hats at the moment. He's the chair of the National Governors Association meeting, so he's in charge. He's our liaison with the White House Task Force, and on all the conference calls, he's the spokesperson for all of us, and he and the NGA staff communicate with other governors in terms of our needs and whatnot, and he's been doing an outstanding job with that. I talk to him often about, I called him with respect to his need for ventilators. I've talked to him about closing down businesses and beaches in that area. I was hoping that we might be able to get him to be on as part of our kind of Mid-Atlantic Northeastern coalition. I'm told that he's joined a coalition with Virginia, maybe West Virginia, something in that area, which probably makes a little bit more sense from him. Maybe it's DC and Virginia, with the Baltimore DC metro area being the really hard-hit area in Maryland. The Eastern Shore, which abuts up to Delaware, the situation there is not as bad as it is on the Eastern Shore. Obviously, the impact, the Delaware Shore and the Eastern Shore are connected, and there's a lot of cross-border activity, and so we will continue to communicate informally with Governor Hogan and his team on issues of mutual concern, particularly as we are thinking about turning the lights back on or bringing down certain restrictions, that we do it in concert, that don't create some unintended consequences, like frankly we had early on in March.
Amy Cherry at WDEL says, with news of yesterday's regional approach reopening states, do you feel that your target expiration of the state of emergency on May 15th is still on point for when Delaware may begin to reopen, or is your sense that it could be sooner or later than that?
Yeah, let's just be clear, that wasn't a target. The governor can only issue a state of emergency for 30 days, and that's 30 days. So I wish I knew. I wish I had a crystal ball and could determine when we're going to reach our peak. It may be the case that because of our social distancing and our stay-at-home order and our quarantine for out-of-state travelers, we've been able to flatten the curve off. We don't know that yet. We don't have enough data to draw that conclusion, so we're still in a stay the course, stay at home, be safe message and mode. But we will continue to start looking at what are the factors that have to be present on the ground for a healthy community so that we can restart the economy, so we can have a healthy economy. You can't have an unhealthy community and a healthy economy. It just doesn't work that way. And so we'll be looking at that. But first and foremost is to keep everybody safe, to continue to get the message out about flattening the curve, keeping social distances, no large gatherings, making sure that we're doing everything we can to protect our neighbors and that our neighbors are doing everything they can to protect us.
The next question is from the Delaware Public Media. I know you touched on this briefly, but it seems we haven't seen the number of COVID-19 cases and hospitalizations that were predicted a week ago. Do you think this is a sign that the outbreak is not as bad, or are we anticipating a delayed surge in Delaware?
Well, first of all, I'd say, the last couple of days doesn't a trend create, and so we're going to be looking carefully at it. Hopefully, it is the fact that our on the hospitalization rate, which is really the thing that we look at the most, that our original conservative, meaning on the high side assumption at 20% of total positive cases, was maybe a little bit too conservative, but as a guidepost, something to keep our eye on. The fact that the positive cases aren't what we thought they might be could be a function of testing. If we were doing more testing, I'd have more confidence in the number being part of a trend. We continue to do more testing, but even 15,000 is a small percentage of the total population of our state. And so we need more data. We need a little bit more time. We'll continue to look at the numbers and hopefully make good decisions, thoughtful decisions based on the science, keeping our community healthy, and then turning the lights back on for a healthy economy.
Matt Biddle at the Delaware State News asks, are you concerned with coronavirus's effect on the economy in Delaware and Delaware's budget going forward?
I'll tell you, it breaks my heart when I have these conference calls with small business owners, like the Restaurant Association yesterday, and I can just hear the anguish in their voices. It's just heartbreaking. I mean, a restaurant establishment near where I grew up, the owner who's owned it for 30-some years talked yesterday about what it's done to his business. This has been a centerpiece of that community, that part of the world for generations. It just breaks your heart. And so, I know that that's the effect of our shutdown. That's the effect of a state of emergency and an order that we had an action that we had to take to protect people's lives and to protect the health and welfare of every Delawarean. And so I'd like to say we won't turn the lights back on or move the dimmer switch up a day too soon or a day too late. But we will err on the side of making sure that people are safe and secure, making sure that we're following the science, that we have the tools we need to test, to isolate, and to track.
Just one more question for me.
Sure.
When you say that we need more testing, what does that specifically mean? What does that look like? Is it we need 30,000 people to be tested opposed to 15,000? Do you have any specific numbers?
I don't. I'm going to defer to Dr. Rattay, but what I can tell you is that we've only been testing asymptomatic patients, right, or individuals. And so that's somebody who feels like they have the flu. They call their primary care doctor. The doctor, or if they don't have a primary care doctor, they call our hotline. And the primary care doctor says you have the fever, you have the cough, you have the various symptoms. I'm going to give you a script to go down and get a test at one of the 7 testing sites across our state. Well, a lot of people, they don't want to do that. They got to go to work. They're an essential employee. Maybe they'll take, we have a lot of people testing for fever. Maybe they'll take some Tylenol and bring their fever down because they got to go to work. We're not testing asymptomatic people, and we know that there are asymptomatic people that have the virus. So if we could test a lot more people, then we'd have a better idea of what the spread has been. And so as we get into this new phase, and instead of shutting down everything to protect people, we will be testing and isolating people who have the virus, fewer number because of what we've done so far, and allowing more people to be active in the community, if that makes any sense. Dr. Rattay?
Yeah, we have a group that we're calling a testing collaborative. We came together, I guess, 5-6 weeks ago when we knew we wanted to ensure access to testing. So we have all the hospitals and more as a part of this collaborative. And now we're, entering a phase of really starting to discuss what is that going to mean as we go into the next phase of thinking about, how do we use testing to reopen our economy. As the governor said, to date, it's mostly been people with fever, cough, and shortness of breath who have been able to get tested. We know that, pre-symptomatic people or early symptomatic people have a lot of other symptoms that we're not catching them early enough. And so as, I would say Delaware has been doing better than many states because of the collaborative approach we've taken to testing and testing supplies. But nonetheless, it's still not as much as we would like. We'd like to test, people with very early symptoms and get them isolated. We'd like to test people who've been, who've had a high-risk exposure, maybe 7 days after their exposure, and if they're negative, then it's, they can, more readily go back to work. There's a number of scenarios in which having that information more readily is important information for individuals and as well as from a public health and population perspective.
So it's not just the actual supplies to increase testing, it's also the access of finding people who need to be tested faster.
Well, the rate limiting factor often has been just the many different supplies that are required for testing. It's been a challenge all along. I think we've been able to keep our heads above water and maintain the statewide testing approach, and we now have even better access that some of the hospitals are doing testing. There's also antibody testing as well. If I can, I'd like to comment about antibody testing for a moment, because there is a lot of press coverage on antibody testing, and we're eager to follow the science around antibody testing to see the value of these tests going forward. I think a lot are putting a lot of weight into these tests as saying if somebody demonstrates antibodies, they can just go back into the real world. And we're just concerned because right now we know reinfection and reactivation of infection has taken place. And so we're interpreting these with caution, but whether it's the PCR testing or the antibody testing, increased access to both those test types are going to be important tools to us having the information we need to know that, once we've got it more contained, that we're staying contained.
What we know is the risk for rebound is high, and so we want to be careful. And the worst thing could be is to do it too soon and then be kind of back in it again. So again, we're going to, be guided by the science, try to make decisions. And again, back to the coalition, I thought one of the things I really thought was would be a benefit of that is just all those different states and their expertise and the science that they're going to use to make their decisions will be helpful to us. All right, well, I guess that's it for today. Again, I want to thank the media for coming and for helping us to get our messaging out to the people of Delaware and the people that we work for. We appreciate you being here and your questions. And just the message is stay the course. We're in this together. We still have a state of emergency in Delaware. Stay at home, practice basic hygiene, protect your neighbors.